unexpectedly. Oh, come on.
Huh?
We are live. Apparently, technically, it says we're shut down, but it says we're live. So hello there. Welcome Wednesday to our Wednesday discussion with myself, Tim Wagner, and Dr. Dineo. So I'm an international speaker and breathwork alchemist. And that means I use breathwork as a way to create a state of change in my clients, an emotional change. And it's a powerful one linking to well-being in the workspace. So that's who I am. Who are you?
Hello. My name is Dr. Dineo Sufolokochatambo. Call me Dr. D to simplify it.
Thank you.
But I'm a medical doctor, I'm a health coach, and I'm a professional speaker who's passionate about preventative medicine and about helping people to thrive, not just survive.
I love that saying. I love it. It's about time we thrived in 25 and not merely survived.
100%.
And together we are your wealthy advisors, or we are wealthy. Financially, health-wise, probably more health-wise than financially. But
we'll get there.
You can help us change that. When you partner with Wellthy, you enhance the health and productivity of your workforce. And we've got bespoke health coaching programs and wellness modalities that foster a culture of well-being that empowers your employees and your teams and your leaders to achieve peak performance, which is such an important topic in an ever-changing, high-stress environment and workspace. So that's who Wellthy is. And every week, we're here on a Wednesday for 15 minutes, a lunch and learn, just a snapshot of something that is deserving of conversation and sometimes maybe isn't as direct as we're going to be. So today, we're going to be talking about some feedback that I received from HR and L&D executives, in fact, professionals from around Africa. It was 10 African countries were represented in a conference where I spoke as a keynote speaker in May. And I asked them a couple of key questions of the audience. And it's the results which I was expecting, but not as dramatic as the numbers that I actually got back from them. So we're going to chat around these. We're going to chat around this. Is that a good idea? What do you think, Dr. D?
I love it. I'm excited. I'm excited to hear from those HR executives.
That's it. And I think one of the key things in this in the conference was where the HR professionals put their hand up and said, "Where are the HR? Where is the HR for HR?
Who's leading the leaders?
Who's leading the leaders?" Right. So here's some questions that I asked them, and it was a live poll. It was an anonymous poll. There was over 100 people, about 120 odd people, 10 different African countries from the DRC, Uganda, Ghana, Mozambique, Namibia, Zimbabwe, and even South Africa. We're in this audience. So I did a live questionnaire on the screen while I'm doing my questions, while I'm doing my presentation. And the first question was, on a level of 1 to 5, how severe has workplace pressure and stress been on your health? 1 being, nah, not at all. My health hasn't been affected by workplace stress and pressure. And 5 being, I have actually hit burnout and have had health issues as a direct result of it. So from your experience, Dr. D, what would you think the results are going to be? Noting that these are your HR and L&D professionals. So they are responsible for that benchmark of well-being in their teams and employees.
Yeah. I think we're going to get around a 4, 3 to 4. And I say that because I think if downstream, I mean, I have a client, for instance, who actually developed hypertension from work-related stress. Like I see him on a regular basis now for health coaching. And I can't imagine that if employees themselves are facing the burnout, how much more the HR people who are actually dealing with, the ins and outs of the employees on a daily basis. So I'm expecting, nothing less than a 3.
And that was what I was expecting. But I didn't realize how many people were going to be hitting that 3 and above.
Okay.
19%. So that's nearly a quarter of the audience, a fifth,
Sure.
said they've hit medical burnout, hospitalized, traumatic.
Whoa.
19% of the audience. That is astronomical. 70% said it was bad to severe. So that was your 3s and 4s. 70%. So 89, no more than that. Where are we? Yes, 89% of the audience have had either a bad to severe reaction themselves to workplace stress and pressure.
And I mean, you spend most of your day at work?
That's it.
Scary.
It is a scary number, but it also aligns to the numbers that you get from Gallup workplace results, where you get from, I've mentioned, I think before, around Discovery, who demonstrated the Discovery Medical, where they showed the massive spike in suicide rates of people 50 and above. So the numbers are sort of lining up, but that's the warning. Here's the reality. It's a warning sign.
Yeah.
The second question I asked, do you feel that existing employee well-being programs are working? Maybe I've sort of preempted the other results there. What is your experience on this, on the well-being programs that are in place in companies? Is it working?
Well, I think that's a controversial one because, well, it speaks to why we exist. But I think I think that, the reality is, I mean, like you said, even companies such as Discovery have released statistics saying the suicide rates, amongst employees are going up. But we know that even the mental health statistics themselves are showing the same thing. The mental health of employees in the companies is steadily declining. And so if we have existing employee well-being programs, but yet we still have these issues, then clearly there's a discrepancy between what we're doing and the efficacy of it.
100%.
So I think there's going to be a little bit of a low score on how effective these well-being programs are.
Noting that the people who are voting on this, who are scoring themselves, are the people whose roles and responsibilities is to apply the well-being programs of the companies.
That's actually interesting. I never thought about that.
Right. They're pointing at themselves and saying, what I'm doing, is it effective and effective? So if you're watching this recording, or if you're here live, because we're here live every Wednesday, if you're watching this recording, put in the comments, what do you feel this number is? What do you feel in your company the effectiveness of your employee well-being programs are? Is it as effective? If you had a look at the numbers of quiet quitters, the sudden resignations where you didn't realize, or those hitting burnout, or increased absenteeism due to sickness, or the disengagement and disconnection, if you had a look at the statistics, they are the result of of how effective your employee well-being program is.
Yeah.
So what are your numbers? So here's the numbers, drum roll. 25%, so a quarter, said that they believe their workplace employee well-being programs are effective. 25.
Okay. And the rest?
65 said sometimes. Not very positive, is it? Sometimes. So here's another question that I come up with when it says sometimes. Is, what are you doing about it?
Yeah.
Is employee well-being still a tick the box?
Eesh.
Right? Where is it coming? Are companies still saying we have an employee well-being program in place because we need to? It's legislated, it's needed, it's good protocol, the staff are asking for it. So we have golf days and yoga retreat once a month, and there's a nice fruit salad in the staff canteen. So we're doing it. but we don't really know how effective it is. Maybe we haven't done the analysis. Maybe we're too scared to.
Sure. Yeah.
That's a lot of questions.
Quite interesting. I mean, and do they know when it is effective and when it's not? So what actually makes it effective? Because they say sometimes. So when is it effective and when is it not?
That's the question. That's the question. So then the next question I asked the audience. Which approach do you believe would have the greatest impact on improving employee well-being in your organization? I gave them 3 options. So now we're saying, okay, there is a challenge, there is a problem. You're identifying perhaps that you don't know the statistics, or you don't even know what solutions would really work. You know it's important. So what do you believe of these 3 would be most important? And it was then rated. Number 1, providing a psychologically safe work environment. So what does psychological safety actually mean to you, Dr. D?
I think for me, when I think about it, it's actually an environment where I can be heard. One, I feel free that I can express my emotions, because sometimes we actually don't even feel that we can share what's going on, in our hearts and our minds. So it's an environment where I feel that I can freely share what's actually happening or going on in my mind or my heart. And I can do so without fear of what might happen as a result or as a consequence of me doing that. In essence, I won't be judged. I won't be treated a certain way. Some of my work privileges or like my work won't be affected in any way. My income won't be affected in any way. My employers won't treat me differently. My fellow colleagues won't treat me differently. So it's just that environment that says, this is a safe space.
Right.
I can be myself. I can be an employee, but I can be human as well in this space.
Right. So you're talking about culture. You're talking about that unwritten culture of people feeling that they are more than just a number. They're valued.
Thanks.
They're seen. They're heard. Right. So that's a psychologically safe environment, which is culture-driven, and culture is driven from the top down. Now, we're not talking about a written culture that's on the website or in the canteen in the staff canteen. We're talking about that unwritten culture. Are they feeling emotionally, psychologically safe? So that was the question. The first one, providing a psychologically safe environment. The second option was including well-being practices into training programs. That was the second one. In other words, it's not well-being practices, not an add-on or something just we have to, but should it be integrated? So if you're doing sales skills training or communication, whatever it is that you're upskilling, but that well-being practices are forming part of that. That was the second one. Sure. And then the third one is increasing leadership awareness on how to identify signs of stress in employees and the teams. So those are the 3 options that people had. What do you think came up highest? Psychologically safe environment, training programs, or leadership awareness?
I would say psychologically safe environment.
Be interesting to hear. Please comment down below what you think would be the ideal way that you believe could have the greatest impact on employee well-being in the workspace. And Dr. D is correct. 45% of the people said it's about the environment. So what they're talking about is they're saying it's sometimes working, often not, but it's down to the leadership and the culture of the organization.
Sure.
The culture starts from the top and then feeds down. Not what I say, it's what I do.
Yeah, I love that.
Right? That's the big thing. The second that came up highest was included into the training programs. Okay. I was expecting a higher result on increasing leadership awareness, because I teach on this, I speak on it, is how do you identify stress in your teams? How do you see it? What are the signs and the triggers that you can target?
Yeah.
But what was interesting here is they're saying, well, if you've got a psychologically safe environment and it's part of the culture of the organization, then you don't need so much of the training to identify it, because naturally the team is less stressed and more focused and well and connected.
And people are more likely to just present themselves as opposed to be waiting to be identified.
Exactly. That's it. So those are very powerful questions. Dr. D and myself are here to ask you, as HR execs and L&D execs or business leaders, how can we help you to put a strong new well-being program into place that actually transforms people, so that people, the teams, feel seen, heard, and valued?
Sure.
Last words of wisdom from you.
Words of wisdom. Ooh. I would say leadership begins with leading yourself, leading through the mirror, leading through the mirror. And if there's something that's not going well in your organization, go back to the mirror.
Brilliant. Love those words. Go back to the mirror. Go look in the mirror. And if you're ready to elevate your corporate wellness and your well-being strategies, in the chats below is the comments. You'll find Dr. D's email address. Drop her a line. Let's connect. Complimentary call, the three of us or two of us with you. Get on. We see where you're at. We do an analysis. We have a look at what can we do to help you elevate that well-being program. And we're here every Wednesday at the same time, 1 o'clock. Follow us on YouTube or on Wellthy on LinkedIn, and listen to our previous recordings. And we hope we're going to be chatting with you all very soon.